Hospital volume and adverse events following esophageal endoscopic submucosal dissection in Japan. Introduction. Endoscopic submucosal dissection, ESD, for the treatment of early esophageal cancers is a well-established, minimally invasive surgical procedure worldwide. Compared with endoscopic mucosal resection, EMR, esophageal ESD is advantageous because it allows en-bloc resection, enabling precise histopathological evaluation regardless of lesion size or configuration. This results in a lower local recurrence rate and a higher long-term survival rate. However, esophageal ESD is technically more difficult than esophageal EMR. Previous studies have suggested that esophageal ESD is more likely to lead to a higher frequency of adverse events compared with EMR. Among the adverse events associated with esophageal ESD is perforation, which is a severe condition that may result in death, although this is rare. Almost all previous reports describing adverse events associated with esophageal ESD involved relatively small samples and only included patients treated at specialized centers, resulting in low generalizability. Using a nationwide database, Odagiri et al. Recently reported two important findings regarding adverse events following colorectal ESD. 1. The rate of postoperative bleeding associated with colorectal ESD was slightly higher than that in previous studies, which were mainly performed at specialized centers, and 2. Hospital volume was inversely related to the rate of adverse events associated with colorectal ESD. Another nationwide study of 27,385 gastric ESD procedures showed similar results. However, no studies have addressed the adverse events associated with esophageal ESD in a nationwide setting, and the relationships between hospital volume and the occurrence of adverse events associated with esophageal ESD have been poorly understood. In the present study, the authors examined the occurrence rate of perforation and perforation-related disorders following esophageal ESD and clarified the relationships between hospital volume and adverse events following esophageal ESD using a national inpatient database in Japan. Background and aims. Esophageal endoscopic submucosal dissection, ESD, has gradually acquired popularity as a minimally invasive surgery for early cancers not only in Japan but also in other countries. However, most reported outcomes have been based on relatively small samples of patients from specialized centers. Therefore, the association between hospital volume and the rate of adverse events following esophageal ESD has been poorly understood. Patients and methods. Using a nationwide administrative database in Japan, Odagiri et al. Identified patients who underwent esophageal ESD between 1 July 2007 and 31 March 2013. Hospital volume was defined as the number of esophageal ESD procedures performed per year at each hospital and was characterized in two quartiles. Results. In total, 12,899 esophageal ESD procedures at 699 institutions were identified during the study period. Perforation and perforation-related disorders were observed in 422 patients, 3.3%, and one patient died after perforation. There was a significant association between a lower hospital volume and a higher proportion of adverse events following esophageal ESD. Although not statistically significant, a similar tendency was observed in the occurrence of blood transfusion within 1 week after ESD and all-cause in-hospital death. Multivariable logistic regression analysis showed that hospitals with very high case volumes were less likely to experience adverse events following esophageal ESD than hospitals with very low volumes. Conclusion. The proportion of perforation and perforation-related disorders following esophageal ESD was permissibly low, and there was a linear association between higher hospital volume and lower rates of adverse events following esophageal ESD.